be discussing. And this next question is treatment of complicated malaria in children. Treatment of complicated malaria in children. All right, so just trying to look at all the drugs that are very important in treatment of this. So complicated malaria requires urgent hospital treatment. So first of all, you should know that it is an okay, so you treat them, okay, treat the complications and all of that. So what is complicated malaria? It's actually severe malaria. There's a lot of danger signs. The person is having impaired consciousness. The convulsions are repeated. There's severe anemia, respiratory distress. The child is in shock, acidosis, hypoglycemia. Sometimes they are unable to even drink. So children with these features must be treated immediately. Okay, so first line of treatment is what? Artesunate. Okay, so intravenous artesunate. Severe, that means the child is almost going unconscious or is unconscious. So so dosing. So intravenous artesunate, you give it around 0, 12 and 24 hours. Okay, switch to oral ACT. That's once the child is stable and is able to swallow something. Okay, so they give drugs like Artemether, lumefantrine. So alternative medications, you can give stuff like, that's if the intravenous artesunate is not available, you can give intravenous Artemether and intravenous quinine. So you manage complications like if the child is hypoglycemic, you give intravenous dextrose. If there's anemia, you can actually transfuse. If there's seizures, you can use benzodiazepines like what? Diazepam, midazolam, phenobarbital. If the child is in shock, you give intravenous fluids. Okay, if there's respiratory distress, you place them on oxygen therapy. If there's acute kidney injury, just monitor urine outputs. Okay, then also place them on dialysis if it is available. Then fever, you can use drugs like what? Paracetamol, then also the tepid spongin. So supportive care is just all this oxygen therapy, treating other infections that could actually come along too, like pneumonia, sepsis. Correct the electrolytes. Then you put the nasogastric tube for feeding. Then frequent monitoring of vitals and neurological status. So investigating malaria testings, blood glucose, full blood counts, electrolyte, urea and creatinine, then also blood gas if it is available. So that's what we got for how to treat complicated malaria in children.